So here are the top 5 Medicare questions answered. Hello, this is Dr. Ed Weir, retired district manager of Social Security Administration. Me and my team of former Social Security employees help people nationwide navigate Social Security and Medicare. So let's talk about the 5 most frequently asked questions about Medicare. Number 1 is, what is it? Well, it's a federally administered health insurance program for people 65 years and older, and people who have been receiving Social Security disability for 24 months or longer, and people with end-stage renal disease. So those are the people that sign up for the various parts of Medicare. And that leads us into question number 2. What are the different parts of Medicare? Well, you have Part A of Medicare. It's called hospital insurance. So that's what covers you when you go into the actual hospital. And for most people, Medicare Part A is free if you paid your FICA taxes, which also includes your Medicare tax. If you didn't, if you don't have enough quarters of coverage, then you will be charged for Medicare Part A. But for most people, Medicare Part A is free. Then there's Medicare Part B, and Medicare Part B covers the doctors. So any type of outpatient, going to your local doctor, getting an MRI, a blood test, or something like that, it covers that. A lot of people don't understand that when you're in a hospital and the surgery service and all of that, the room and everything is covered by Part A. But when your doctor comes in and actually, does the actual surgery, that particular doctor, that is covered by Part B. Okay, so that's the medical insurance, Part B, and there is a charge for that. This year in 2023, that's $164.90. Okay, and then there's Part C. Part C is in cat, and that's a Medicare Advantage plan, because Medicare Part A and Part B, the original Medicare, obviously doesn't cover everything. In Part B, it's they pay 80% of covered services, so the other 20% you're obligated to pay. So a lot of people get Medicare Part C, which is a Medicare Advantage plan, and you get those through private company. There's many companies throughout the country that can provide you with a Medicare Advantage plan. And me and my team are contracted with the largest and many other smaller local Medicare Advantage plans throughout the country. So if you're looking at a Medicare Advantage plan, please give us a call and we can find one that suits your needs in your particular area. Okay. And then there's Part D, as in dog. So the prescription drug plan. And those are also administered by private companies throughout the country. And that covers, obviously, your prescription drugs, anything you receive prescription-wise outside of a hospital. And then again, that's a particular plan that you sign up for through a private company. And again, we can help you sign up for a Part D plan after we do some research and find out exactly which one is the best one for you. And then we'll provide you some options, and then you tell us which one you want to enroll with, and then we do the rest for you. And then there's also a Medicare Supplement plan. As I mentioned, Part B of Medicare, for instance, doesn't cover everything. There's 20% what you're obligated to pay. A Medicare Supplement plan, again, provided by private companies throughout the United States. A Medicare Supplement plan goes in there and picks up the rest of that 20%. And again, some Medicare Supplement plans, we can help you find the best Medicare Supplement plan for your particular needs and get you enrolled in one of those. All our services are free. All Medicare insurance agents don't charge. They get paid directly from the insurance company. And hopefully, if they're contracted with enough of the insurance companies, they're actual brokers rather than captive agents, they can shop around and find the best plan, and then you make the decision. Doesn't matter which particular company you choose. Medicare insurance agents make the same amounts regardless. And again, one of the things we do, one of our unique services that we provide that pretty much nobody else can, is because we're former Social Security employees. When you become one of our clients, then we not only help you next week, next month, and next year with all things Medicare, But because we've got decades of experience, inside knowledge of Social Security, if you, your family, friends, next door neighbors have an issue with Social Security, you receive a weird letter you don't understand, your brother, uncle wants to file for disability, just tell them to give us a call and we will walk them through the system. That's an extra service we provide that most other Medicare insurance agents throughout the country try to provide, but please, a lot of them have essentially taken a 2-day course online, and now they call themselves Social Security experts, and they are not Social Security experts. There's over 20,000 pages of Social Security rules and regulations, and you can't learn it in 2 days. So please contact us. We have decades of experience, and we are the experts in that particular field. Question 3, how do I enroll in Medicare? Well, you go down to your local Social Security office and enroll that way, or you can go online. And as I mentioned, when you're about to turn 65, a few months before, if you're currently receiving Social Security benefits, you don't have to do anything. You'll receive your packet from Medicare a few months before your 65th birthday, and you'll be automatically enrolled. You can watch my other video on how to refuse Part B if you so choose. You can, if you're not receiving Social Security benefits already, then you will actually have to go down to a local Social Security office, or again, file online, ssa.gov. You can file your Medicare application online for Part A and Part B, or just A if you're currently working and receive health insurance from work and your company has 20 employees or more. And again, Part C and Part D and a Medicare supplement, Social Security Administration can't help you. You need an agent, a broker, or contact a particular company, insurance company, Medicare insurance company in your particular area to get you signed up. To enroll in Medicare online is pretty easy through ssa.gov. If you don't want to do it online, you can call the 800 number, Social Security 800 number, 772-1213, and schedule an appointment. Or what I probably wouldn't suggest is just do a walk-in. Just jump in your car, head down to the local Social Security office, and just wait in line. That takes usually several hours. If you have an appointment, if you have a 10 o'clock, at least in my office, if you had a 10 o'clock appointment, there was a 99% chance we would call you at 10 o'clock exactly or sooner. So we were pretty good at keeping appointments on time. I'm not sure about other offices throughout the country, but again, it's slow staff, kind of reduced staffing throughout the country, so it might have changed a little bit. Hopefully, it hasn't. Question number 4: how much does Medicare cost? Okay, so again, as I mentioned, Part A is free for most people, the hospital. Part B of Medicare this year, 2023, is $164.90. And again, so that's your monthly premium for Part B. If you are low income, you can actually apply to your Medicaid or Medi-Cal system in your particular state and see if they will pick up your Part B premium. If you have any questions on that, reach out to us and we can kind of help you go through the system. And again, Part B has 20% that you're obligated to pay. Part C, Medicare Advantage plans, it depends on your particular area, the particular plan, but a lot of those have 0 premiums per month. So it's you still have to pay your Part B premium of $164.90, but a lot of the Medicare Advantage plans are 0 premiums, and they also include dental, hearing, and vision, and gym membership, and a lot of the other things. And a lot of them, most of them, majority of them also include Part D, the prescription drug plan. So a prescription drug plan, standalone, all by itself, $25, $35, $45, something like that. But when you get a Medicare Advantage plan, the Part D plan is usually bundled in there. So you don't have to pay the extra $25, $35, $40. It's just 0 premium per month. If you decide to go the Medicare Supplement route, depending on a particular area and your age and the plan and everything, The most popular one right now is the Plan G, and those are about average about $125 a month. So again, you still have to pay your $164.90 for Part B, but you also have to pay $125 for the Medicare Supplement plan. And it doesn't include, vision, dental, hearing, gym membership, or anything like that. And it doesn't include prescription drug plans. So you'll have to pay the $125 plus you also have to sign up for a prescription drug plan and get another $25, $35, $40. But there are advantages depending on your particular situation to signing up for a Medicare Supplement plan versus a Medicare Advantage plan. And that's something that if you want to do it yourself, quite a bit of research to find out which one is the best for you in your particular area, or you can take the easy route and give us a call.